Hey guys, so I wanted to talk to you today about first day of nursing school. So I had my first day of nursing school today. Eee, how exciting. And I just want to do a quick little video just kind of explaining what to expect, how to prepare, maybe, what people wear, because I know that's kind of a big thing. And just, yeah, because I know before I went to my first day of nurse school, which was today, so the past couple days, I've been YouTubing like every video under the sun of what to expect the first day in nursing school because it's very nerve-wracking. Everyone talks about how intense nursing school is, and the last thing you want to do is walk in and be unprepared. Nobody wants that. So, all right, let's get started. So when you arrive at class, the first thing that you're going to kind of go over is the student handbook, kind of like the basic stuff that you learned in orientation. And then you jump right into it. You jump right into the lectures. We covered three chapters today. So, we were there getting lectured for about 3 hours. And we also go over like health and wellness and our role as a nurse in providing that type of care for our patient or our client. So that's kind of cool stuff. After that, we had a facilitator meeting. So we are each assigned, there's probably like 10 people per advisor. We're each assigned an advisor, which is one of our instructors. And they are kind of our go-to mentor person, which I think is really, really great. Okay, another thing, I'm not sure about your program, but I would assume, especially like in Massachusetts, that it would be the same because that's where I am, but you have to be CPR certified, and you have to be CPR certified by the American Heart Association. So the Red Cross Association CPR is not, it won't be good in Massachusetts hospitals for some reason. I don't really know. So that's just, a little note in there. So kind of like the gist of being in class, I will say that most people did bring a laptop to go through the slides. If you guys know, if you've taken other courses, typically a teacher will put the slides on the board and they'll talk. So most people, like 90% of the people, did bring a laptop. I did not. And I chose not to bring my laptop because I feel that if I have my laptop in front of me, I will be distracted, especially when you're sitting in like a 3 or 4 hour lecture. And you get that little voice in your mind. It's like, I wonder what's going on Facebook right now. Like, I know she's talking about the nursing process, but I'm kind of distracted because I saw this cute dog earlier on Facebook. You know what I mean? So I didn't really want that to happen. I wanted to be present and in the moment and mindful. So I chose not to bring my laptop, but that's completely up to you. Most people did bring their laptop. I also, on my phone, actually I can show you guys this. So on my phone, I recorded the lectures. I've been reading a lot about this online, and people have said that this is like one of their biggest things is to record the lectures. So I use Microsoft Office OneNote. I'm not going to play the lecture because I don't know if that's like against any policy, but pretty much at the top I'll put the date of the class. You guys can't really see it. And then you just click to type, and then there's a button with a little microphone. You just click the microphone and it will make an audio recording. It's not going to show you, is it? No. So that's what I do, but there's lots of different apps you can use. I also, on Microsoft OneNote, take notes. These are the different, so each unit, we're tested on different units. So there's like unit 1, exam, unit 2 exam, unit 3 exam. Within each unit, they give us what they call sub-competencies, which is pretty much the generalized things that you need to know. So it would be like explain the nursing process or something. It's kind of making sure that you know those key points. So in Microsoft OneNote, I put the answers to those sub-competencies, and the reason I use OneNote is because it uploads, well, there's a couple of reasons. You can move things around the page, which is really cool. You can also add audio recordings, which is really cool. And it uploads to a cloud database, so I can pull that up anywhere on any device, which is nice. I don't use it for rewriting. So after I go to lecture, I rewrite my notes. I put the main topics on one side with the like definitions, kind of like those split page ones. And I don't use OneNote for that because that really just needs to be typed up and printed. So I just use a regular Word document. But the sub-competencies are good to have like on my phone if I want to pull them up or, whatever. So I'm kind of perfecting my study habits right now. I will say between orientation and the first week of school, they tell us to get started on a lot of the stuff. So I did that. And what I've noticed is there is a lot of information. Nursing school seems to, and I'm literally only in first week, bombard you with information. Coming from a science background, I am good with textbooks, with dense information, but I need to know everything on this page in science, right? In nursing, it's like the concepts aren't super difficult. Like it's not like orgo, but it's a lot to know. It's not only the book, but it's the read. There's, 7 books. I got 7 books like this. So on top of all that information and retaining the information, you then have to be able to answer these critical thinking type questions. So I'm trying to read the book, take the notes, organize my thoughts, and also do practice problems. So I got this book, but I haven't really dived into it yet. So that's kind of like the next thing on my list. So the last thing I will say about the first day of nursing school is get yourself a planner, because there are lots of due dates for lots of things and there are lots of chapters that need to be read. So I came up with a game plan. I'm slightly, when you come up with a game plan, you slightly change it as you go. So I've been changing it a teeny bit. But pretty much every day, I have the assigned chapters that I want to read, and then, what I want to do as far as making the split sheets after lecture. And I think just having a set game plan. I didn't do the whole semester, but I kind of mapped out the first month and a half of what I want to get done when, because again, you're bombarded with information. If you slack at the beginning, I can totally see how it would snowball into you failing, which would be horrible. So we don't want that to happen. So let's see what else. Okay, to bring to class. If you're writing on the slides, obviously a pencil, but also bring highlighters, which I know people are like, why are you telling us this? But I never bring highlighters, and I just happened to bring one today because everyone said that they use them. And definitely good, because when you're going through the slides, there are certain things that your professor's going to say, you need to know this, or highlight this or whatever, and you can just kind of highlight it, and that's really nice. Bring a snack. I got this today. I haven't tried it, but looks like it'd be good. I'm a vegan, so it's vegan rice protein chocolate trail mix. Because I also brought an apple. That's why I didn't eat this, but that's my backup. Because you're sitting there for 4 hours or 3 hours, and you get hungry, and you can't. There's you have a 10-minute break in the middle, and that's where I got that bar. I walked over to the caf, but it's if your school is bigger and busier, you're not going to have time to go and take your 10-minute break to walk to the caf and get food, and it's just long. It can get long, so definitely have some food with you, definitely have a drink with you. But yeah, so you just nursing school, you dive right in. There's no first day of class, you review the syllabus, typical classes. It's first day of class, you cover 3 chapters and the student handbook. So just prepare yourself to be bombarded with information. That's what I would say. What to wear your first day. I didn't find any videos on this, not one. So I'm going to tell you what people wear. It is a spectrum. My personal preference is always keep it tasteful. You want to look professional. You need to remember that you are caring for patients, and you are representing that school in a healthcare setting. I'm the type of person that I am non-judgmental. Girls want to wear whatever they want to wear. Do your thing, girlfriend. But there's a time and a place. That's how I feel. There's a time and a place for everything, you know what I mean? You want to portray an image of being professional and being you want to show that you're taking it seriously. If you're not feeling well, I understand you want to walk in with sweatpants. It's cold, it's winter, there's snow. Yeah, of course, that's fine. But first day, I would say keep it tasteful, keep it classy, keep it professional. It can be casual. So like casual. You don't need to wear a suit jacket or anything like that, but just kind of dress nice. I guess what I wore is this little cute bell sleeve shirt, and I have pajama pants on right now, I'm not gonna lie to you. But I wore gray jeans with it and some white clogs. So that is my first day of school. In summary, I hope that you guys enjoy and got at least maybe one tidbit of information out of this, and I look forward to giving you new videos soon. So if you have any comments, make sure to drop them below. If you have any preferences on what you would like to see in a video or what you would like to learn more about, you can message me, email me, or comment below. Make sure to subscribe to my channel. We're almost to 500. I'm going to do a 500 giveaway, but don't tell anyone. I don't know what it's going to be yet, but 500 giveaway. Super excited. So, yes. Okay. Thanks, guys. Bye.